Hello guys, again Umar with you. Today we're going to talk about the choledocal cyst. Choledocal cyst is a congenital abnormality characterized by the dilation of the bile duct. It's a rare condition that occurs in approximately 1 in 100,000 people. The cyst is formed due to a malformation of the bile duct during fetal development. The exact cause of this condition is not known, but is thought to be related to a combination of genetic and environmental factors. There are several types of choledocal cysts, including type 1, 2, 3, and type 4. Type 1 is most common type, accounting for approximately 80% of the cases, and involves the dilation of the entire common bile duct. Type 2 involves the dilation of the extrahepatic bile duct, while type 3 involves the dilation of the intraduodenal bile duct. Type 4 is a combination of type 1 and 2 and 3. Choledocal cysts can cause several complications, including recurrent infection, biliary obstruction, pancreatitis, and liver damage. And the treatment of the choledocal cyst typically involves surgical removal of the cyst and reconstruction of the biliary tract. The signs and symptoms of a choledocal cyst can vary depending on the type and size of the cyst, as well as the damage of the individual. In some cases, the condition may not cause any symptoms and it may be discovered incidentally during an imaging test or surgical procedure for another condition. However, some common signs and symptoms associated with the choledocal cyst include the abdominal pain, jaundice, nausea, fever, and chills, pale stools and dark urine, also weight loss and enlarged liver. It's important to note that the signs and symptoms of the choledocal cyst may be similar to those of other conditions such as gallstones or pancreatitis. Therefore, through evaluation by the doctor is necessary to make an accurate diagnosis. The diagnosis of choledocal cyst typically involves a combination of medical history, physical examination, and imaging tests, which I will explain them. Ultrasound. Ultrasound can help to detect the presence of the cyst and assess the size and location of the cyst if there is a cyst. We have magnetic resonance, MRCP, which is a type of MRI that procedures detailed images of the bile duct and pancreas. It can help visualize the cyst and any associated abnormalities in the biliary tract. CT scan can help to identify again the presence of the cyst and any associated complications. We can use ERCP, this procedure that involves the insertion of a flexible tube with a camera into the mouth and through the stomach to the small intestine. Dye is then injected into the bile duct to help visualize any abnormalities, including a choledocal cyst. Liver function test, blood tests that assess liver function can help identify the abnormalities that may be associated with the choledocal cyst, such as elevated levels of the liver enzyme ALT, AST, and so. It's important to accurately diagnose the choledocal cyst to determine the appropriate treatment plan and prevent potential complications. The treatment of choledocal cyst typically involves surgical removal of the cyst and reconstruction of the biliary tract. The goal of surgery is to remove the cyst and any associated abnormalities while preserving liver function and bile flow. The specific surgical procedure you'll use will depend on the type and location of the cyst. After the surgery, the patient may need to stay in the hospital for several days to monitor for any complications. Pain medications, painkillers, and antibiotics may be prescribed to manage pain and prevent infection. The patient will also need to follow a specific diet and activity plan to aid in recovery. The long-term outlook for individuals with a choledocal cyst depends on several factors, including the type of the cyst, the extent of surgery, and any associated complications. With appropriate treatment and management, most individuals can expect to have good outcome. In terms of lifestyle change, individuals who have undergone surgery for choledocal cyst may need to make some modifications to their diet and activity level. It's important to avoid fatty or greasy foods and to eat a balanced diet rich in fruits, vegetables, and whole grains. Exercise is also important for maintaining overall health and preventing complications such as obesity and diabetes. That was all. Thank you for listening. Bye.